Great, thank you very much, and to the conference organizers for inviting me to speak. I'm presenting this on behalf of the Liver Life Study Group. Here's my disclosures. So when we look at enhancing sort of care for people who with hepatitis C, I think it's all sort of recognized that HCV testing and diagnosis remains low globally. There are fingerstick and oral fluid rapid diagnostic point-of-care HCV tests. However, the big limitation with the existing assays is that they measure HCV antibodies, which indicate previous exposure, not HCV RNA, which indicates active infection. So there's a new technology, the XpertHCV Viral Load point-of-care assay developed by Cepheid. It's in an automated, self-contained, single-use. It's random access. It has CE European approval for plasma testing. It's a single platform for integration, so you can do HIV, HPV, TB, gonorrhea, chlamydia. So there's sort of a menu of different tests that you can order. Relatively minimal training. It's a relatively rapid test, 60 to 108 minutes. And capillary blood is in beta testing right now, and there's multiple configurations from a sort of Nespresso single version kind of quick test to sort of larger machines. So the study aims was to determine the sensitivity and specificity of the XpertHCV Viral Load point-of-care test for detection of HCV RNA by plasma samples collected by both venipuncture and capillary whole blood samples collected by fingerstick among participants attending drug health and homelessness settings in Australia. So the study participants come from the Liver Life study, which is an open observational cohort study evaluating the effectiveness of an intervention, integrating non-invasive liver disease screening on HCV assessment and treatment uptake. The inclusion criteria for this particular study were greater than 18 years of age, written informed consent, and a history of injecting drug use. I should note that participants that were recruited from the homelessness service were exempt from this criteria. So this particular analysis from the Liver Life study consists of participants that were only included from February to July 2016 when we began using the XpertHCV RNA test. We recruited from a number of different sites, one homelessness service, 3 drug and alcohol treatment centers, and 1 NSP service. Just to give you a little bit about the study intervention, so participants were recruited from the clinic waiting area within the individual clinics. They had Liver Life resources, there were food and refreshments, there was a peer support worker who was available, who was a person from the community. Participants were informed about the study and were consented, had a fingerstick and dry blood spot testing performed. They had a self-administered survey on tablet computer. They saw an infectious disease specialist for a FibroScan. And then the participants saw a nurse who was at that particular clinic for consultation and venipuncture. And that was really sort of the key linkage to care component for the study. Then they also had a post-assessment FibroScan survey. In terms of the venous blood and fingerstick samples, so venous whole blood was collected by venipuncture, centrifuged, and loaded in. The plasma was loaded into the XpertHCV Viral Load cartridge. And then the results were obtained in 108 minutes. That's the run time. Fingerstick capillary blood was taken in a 100 microliter mini-vet tube. Blood was loaded into the XpertHCV Viral Load cartridge, and a 1 ml dilution buffer was added. Again, the result was available in 108 minutes. And we had a gold standard comparator of plasma and tested using the Abbott real-time assay on the M2000. So this gives you the participant disposition. 210 participants were enrolled, 2 were excluded for having no sample available. So available samples were in 208 individuals. Of these, 198 individuals had fingerstick whole blood sample, and 184 individuals had venipuncture sample. I just wanted to mention in the 24 individuals who had no venipuncture sample, this was due to 42% of patients refusing to have their blood taken, and 33% of individuals having poor venous access where the blood couldn't be taken. And in that subset, 58% were actually HCV RNA detectable on Xpert testing, demonstrating how this is an important population to be getting results from due to poor blood access. So in total, there was 158 individuals that had available results for all 3 assays. There were 8 individuals who are currently receiving DAA therapy, which were then excluded. So the overall population for analysis was 150 individuals who had all 3 results for all 3 assays. Just to run through the participant characteristics, so there's 150 individuals, 13% were female, 44 years median age, 65% history of drug use. You'll see it's a little bit lower than you might expect in this population, given the fact that we recruited from one of the homelessness settings, which had a lower prevalence of injecting. So overall, there was sort of 15% who had sort of less than weekly injecting, 13% more than weekly but not daily, and 11% daily or more. There were 27% of individuals that were currently receiving opioid substitution therapy, and 11% were F3/4. So HCV RNA prevalence was 30% based on the Abbott real-time assay. Again, lower than you would expect, but that's because of the fact that this homelessness setting was included. Okay, so looking at the sensitivity and specificity, this is looking at the data of the Venipuncture. So Venipuncture compared in the gene Xpert compared to the Abbott real-time. Overall, there was sensitivity of 100% and a specificity of 99.1%. There was one discrepant result. This participant had an Abbott undetectable levels, and on the Xpert testing was just over 3 million international units per ml. If we look at quantifiable and unquantifiable, so greater than or equal to 10 for the Xpert and greater than or equal to 12 for the Abbott real-time, there was the sensitivity was 97.7% and the specificity was 99.1% with 2 discordant results. One of these was again the Abbott unquantifiable and Xpert quantifiable at 3,380,000. And the Abbott 38 international units and Xpert unquantifiable. We did go back because this is sort of an interesting result, and we did, using an in-house RT-PCR, did determine that this was a detectable result, demonstrating a false negative result on the Abbott testing. This is looking at the fingerstick data. So overall sensitivity was 95.5% and sensitivity was 98.8%. There was 4 discordant results. 2 of these were undetectable on Abbott testing, with Xpert being just over 7 million, and the second result being Xpert being detectable but unquantifiable. In 2 results with Abbott, less than 12, and then undetectable on the Xpert, 38 international units on the Abbott, and undetectable on the Xpert. If you look at the quantifiable and unquantifiable, there were 2 discordant results. The sensitivity was 97.7% and specificity was 99.1%. And again, unquantifiable in ID18 and just over 7 million, and this result of 38 international units and unquantifiable. And just to make, this is the same participant where we went back and did RT-PCR testing on the plasma sample and was demonstrated to be a false negative on the Abbott testing. So just in terms of study limitations, I think it is a small sample size, and really we do need further studies to assess reproducibility, particularly in other study populations. There's a selection bias that may have led to greater sensitivity and specificity than might have been observed in a population with a higher HCV RNA prevalence. The time to result was 108 minutes, which isn't ideal, but there is a modified version of the assay that's under development with a time to result of 60 minutes. So just in conclusion, the sensitivity and specificity of the Xpert HCV Viral Load test for HCV RNA detection by fingerstick whole blood collection was 95.5% and 98.1% respectively. This does provide a major advance over antibody point of care tests, which only indicate HCV exposure, so being able to detect active infection. The findings certainly support further evaluation of the Xpert HCV Viral Load test for HCV RNA detection by fingerstick whole blood collection. I'd just like to mention that this certainly was a team effort. We had a team of researchers that went on the various campaign days, and it's a really excellent project to be a part of. There's a large number of people that were involved. Particularly, I'd like to thank Merck and Cepheid for the funding for this project, and all my collaborators and colleagues at the Kirby Institute, and all the people involved. Thank you very much, and I'd be happy to take any questions.
Great. So thanks very much. We have time for a couple of questions. I guess I'll start. In that 108-minute period where people had to wait, did you have issues with people leaving and not receiving the results?
Yeah, actually one of the issues is that because it's a research test, we're not actually able to provide the participants back their results. So it's a sort of a, it's really early days. We're working towards being able to do that, but a lot of the participants did have standard of care phlebotomy taken on the day, but they would have to come back as per the standard of care to get their blood results back. But yeah, hopefully the company is, as I said, it's under beta trials right now. Find is doing some work around to try and get CE marking. So hopefully, it's a test that will be able to be used in the clinic in sort of the next sort of year or two.
Dr. Lee?
I'm confused by that one very discordant sample that showed a viral load of 8 million on your test.
Yeah.
And negative by Abbott. Did you say that you went back and retested it and it was a true negative?
Yeah, so it's
So
not my test.
why did the Abbott assay suck so bad on that? Holy
So
cow, that's not even close.
So Sam, it's not my test, it's Cepheid's test. So that's the first thing. And second of all, false negative results have been reported with the Abbott real-time test. It's is an anomaly. We used the same sample in terms of there's plasma aliquots off the same sample. There's no difference in freeze thawing between the two samples. So I'm not sure why that particular Abbott test failed in that instance, but we did test it with an in-house semi-quantitative PCR, actually developed by Melkrajtin's group. So we're pretty certain that it's a true positive.
As a disclaimer, on behalf of the CanHEP-C organizers, we do not hold the opinion that the Abbott assay sucks.
No, I think the Abbott real-time is a incredibly good assay, and it's been well validated. So it's just an anomaly. We have an expert on diagnostics. You can chat with Jean-Michel. I'm sure he would be able to discuss it with you. Anyways, thank you very much.
Yeah, no, thank you very much. That was a great talk.
Thanks.
So we'd like to.